Dr. Bowler, you have an MBA. You have much more kind of focus on that business side of ophthalmology. What are the things you look for to make sure your business is being healthy?
Well, Heather, thank you so much for having me over for this short video clip. It's so essential with the changing healthcare landscape that one has to be very business savvy to have to sustain a good, thriving practice. For me, I always kind of like to break it down into multiple different parts. The most important thing, of course, is patient satisfaction. I'm always want to focus on a patient-centric practice. So what can you do to improve your patient satisfaction? I think the most important thing for the patients, if you ask me, is the wait time. So I want to improve a good journey for them the moment they schedule their appointment to their post-op visit. And there are a lot of operational efficiencies that come into play here. How can you create a lean process
Mhm.
for them? So one important thing I have found in my practice is always to have a good huddle with your staff in the morning so that we know what we are anticipating in the day. We can plan our day ahead. And then I feel that optimizing my EMR and my template, those are the two things which have played a big role in my practice. We've kind of optimized our template in a way where we feel that we can kind of schedule the kind of patients that come to our practice, be it a dilated patient versus a non-dilated patient, a neuro patient versus an easy failed vision screening. So we can kind of allocate the time accordingly if we know which patient is more complicated, would need more time. And then the EMR integration is very important. If your diagnostic testing can be easily integrated into the EMR, it kind of definitely improves your efficiency, reduces the time you spend on the screen, and you can kind of then spend more time with the patient talking about the diagnosis and the management. So I think the patient satisfaction is the key, but one very important thing is to monitor your financial metrics. And I always feel that looking at the volume of your patients, and I do it every week, looking at your average revenue per patient and looking at the reimbursements you're getting from different, insurance companies, because as you know, it varies, like it varies in our field. So just kind of trying to keep a close watch on what your AR is. Are you actually profitable? What your cash flow is? Again, the cash flow is so important because if you are investing in state-of-art equipment or even marketing, you need to ensure that you have the cash flow for doing that. And lastly, but not the least, building relationships, I think, is very important. You got to definitely build relationships with the community, with whoever is your referral source. In my case, it's a pediatrician. So, have a good rapport with them, just so that they support you and they help you in your marketing efforts because they will be ultimately the spokesperson for your practice.
That's perfect. So my question for you would be, especially when you talk about patient satisfaction, what really comes to mind is the idea that time equals money, right?
Yeah.
Everything you're doing is to become more efficient so that you can make sure that the business is being able to sustain itself. Um, when you look at that and you look at all your referral sources and you look at how busy you are for the day, how do you balance managing the business side of the practice with the clinical side of seeing patients?
That's an excellent question. And I think, Heather, the business side of medicine, once you have it in your mind, you're always thinking about it at every step, So definitely the MBA gave me the tools to think about it. But honestly, you don't need to do an MBA to learn these things. I think once you're kind of thinking about those things at every step, in terms of the patient volume, how can I minimize my wasteful time, which is I always think there is a lot of wasteful time that goes on in our day. So how can you minimize that and increase your productive time? And I think your staff is very important, plays a very important role here. Your practice managers, They keep you kind of on your path, and we are very lucky to have an exceptional practice manager, who kind of keeps me on my toes. So I think it's a collaboration with your staff, your front desk folks, your practice manager, and that makes your day go really fast.
That's perfect. So my only other question, because that was fantastic, we're going to cut that together and that's perfect. Is what is the best thing about AAOE?
Oh, AAOE, I cannot talk enough about AAOE. I think it has provided me so many tools, especially during COVID, like it just was unbelievable, like how many tools I could extract from AAOE on a daily basis and utilize them to sustain my practice. During that time, as you know, all of us were going through a period of uncertainty. So I think AAOE just brought so many tools to us, timely tools to us. And moving forward, I think it's such a brilliant resource for not only young ophthalmologists, but for all of us, even for us who've been in practice for 25 years, because the healthcare is so evolving and the landscape is just changing at an every month, I would say, something new comes up in our practice. So AAU provides so many tools to refresher courses, coding tools, and I believe I'm going to use it forever in my practice. So thank you for doing what you do for the AAOE.
Oh, you're very kind. Well, thank you.